Hello and welcome back to another video with the Practice Nurse Mentor. I'm Alicia. So in this video, I thought I'd just do a fairly short one on scope of practice. So this is a topic that comes up a fair bit in mentoring of nurses. It also is a hot topic of conversation on discussion forums, various nursing groups and such. So I think it's traditionally a little bit of a grey area. People are a little bit confused by what scope of practice means. So I'm hoping that this little video will try and dispel some of that murkiness and provide you with some information that is linked back to some of our resources that we can access as nurses that are readily available there to search for. So let's get started. So first of all, what does scope of practice actually mean? So scope of practice refers to the specific activities and responsibilities that nurses are educated, trained, and legally authorised to perform. Be mindful of these words. They can be shaped by a nurse's qualifications, their registration type, their education, their relevant regulations bound to them, their competence, and also their confidence. And that's a really important one as well. They can also be influenced by the context in which they practice, and we'll call this scope of clinical practice, and I'll talk a bit more about that in the next slide. And it also can be influenced by their organisational policies or that particular service provider. And I think that kind of flows a little bit further on into the next slide as well when we start talking about clinical practice. So it's basically not really defined as a set list of tasks or procedures. There's some really good fact sheets available through the Nursing and Midwifery Board there on scope of practice. They have a couple of, the fact sheet that they have has some tables in it that really outlines the scope for enrolled nurses, registered nurses, midwives, and nurse practitioners. And then we've also got the professional standards of practice. So they're also available for each of those nursing designations too. So I think because these are fairly broad terms or broad explanations, that is how it can be a little bit grey for some people, and it's not a specific, here's black and white what is in a scope of practice. So it really does come down to the education and the training. We are all starting off with our core learning that we've achieved through our university or our college or our TAFEs or what have you. So that's our core knowledge, and then we go and build on that after we've graduated, that we then go off and we start learning some different skills that to help us navigate our career pathway. So every nurse is going to have a slightly different scope of practice. Every nurse is going to have a slightly different clinical practice because of that massive variety that is there for the kinds of things that we go off and do after we've graduated. So I think that's why, another reason why it really does murky the waters a little bit, because there is no set thing. It's very, very independent of the individual nurse and what training they've gone off and done. The relevant registrations, so that just means if you've got endorsement for certain things, and competencies. We'll talk a bit about that in a second. And then that confidence is also really another big thing, because just because you've been taught how to do something, it doesn't necessarily mean that you feel confident in doing that particular task or administering those skills initially without having some further guidance or mentoring or support. So you might be okay to start off with at a very basic level. So cannulation might be a good example here. It's okay to do it in a fairly controlled environment, but then thrown in the deep end in a busy emergency department, and you're trying to cannulate a difficult situation, someone who's severely dehydrated, you can't find their veins or things like that. So your scope of clinical practice in that instance is reduced. So it would be reasonable to ask for a more competent nurse, a higher trained nurse or doctor to come in and either guide you through so you can continue your learning, or they can take over and you can observe, and hopefully they can help to guide you to some techniques that they might be able to employ that will help to build upon those skills. So confidence doesn't mean that there isn't a competence there. They just need to have that continuing to support and a broader exposure to different situations. So that's another time when you might not be confident, is that you might be exposed to a different situation where you are trying to deploy that skill, and you're out of your element a little bit. And it's okay to say, I'm not familiar with how to do this in this setting. Can I have some guidance on this, please? Can you show me that kind of thing? So they don't necessarily link together. Just because someone needs some support to continue to learn that skill, that doesn't mean that they aren't competent to do it. They just need that little bit extra help. Okay, so moving on to scope of clinical practice. So this is a little bit distinct from regular scope of practice because um, this is a very specific to a role, and it describes the extent of the skills, knowledge, performance, and professional suitability required by a healthcare service. So this just means that, again, different clinical settings are going to um, determine the kind of clinical practice you are going to undertake with your skills and what might be in your scope. So this is often presented in the form of a position description, or it might be in your contract of service, something like that. And that will outline what your clinical practice scope is going to be. So some examples here. In rural and remote nursing, there's often a very broad scope, and there's the necessity to do work to the fullest extent of a nursing scope here, because you don't have access to other clinicians, you don't have access to other services. So there are built-in regulations that provide the legal support, I suppose, to do more in those kinds of settings compared to what you might do in a more metropolitan location. Emergency department, again, as a registered nurse in a busy ED, your skills and the requirement of the things that you're going to undertake as part of your day-to-day activities is going to be very different to someone in an aged care setting, to someone that might be in a primary healthcare setting. So, and there's also going to be some variation between different organisations, whether it's a public or a private institutions. Everyone's going to have different policies on what the nurses can and can't do, and that will determine what your scope of clinical practice is in that setting. So that's, I guess, the distinction between the two, but it all sort of comes together to form what it is that you're going to be able to do in your particular workplace. And I guess this has kind of come into the conversation a little bit more in recent times with the um, potential for nurses to be doing prescribing, registered nurse prescribing. And so there's been some conversation about the scope of clinical practice that how this might look. So just because you can go off and do the training to be a registered nurse prescriber, it's still going to come down to the organisation that you're working for, what they are going to allow you to do as part of your job description or your position description. Um, so again, that might vary quite a lot in those different examples that I have there. What you can do in a rural and a remote setting might be very different to what you can do in an aged care setting. And you can sort of apply that to all of those examples there. Again, there's some really good information available for on the National Safety and Quality Standards. That's a really long guide for healthcare services. If you want to go and check that out, there is some really good information that helps to sort of clarify that there, which might help to do that. So when it comes to education and training, I guess this is one of the bigger arguments that I see happening amongst nurses or other clinical staff is the formal versus the informal. Do I need to go and do a course, or can the nurse that I'm working with who's done the course, can she just show me, or he, can they just show me how to do this? And then am I qualified to go ahead and do it? There's sometimes some pressure from a workplace, especially in general practice, for nurses to be asked, can you just go ahead and do this task? An e-syringe is something that's quickly popping to mind, without them necessarily having gone off and done any formal education on it or training on it. But there is some pressure there to do the procedure because I can just quickly show you how to do it and you'll be right. So this is a conversation that happens quite a lot actually. And so let's talk about what it means and some considerations that we need to bear in mind when we're starting to compare the pros and cons of the formal training versus the informal training. So as you can see from this little table, there are some comparisons and they can be quite stark from one side of things to the other. So obviously our formal training is obviously more structured. It usually comes with some kind of a certification, depending on what it is. You'll come out with a qualification, some kind of a credential, or there'll be at least some kind of recognition of the learning that you've achieved, whether it's a certificate or a statement of attainment, something like that. Pretty much always led by some kind of a qualified educator who has, specialty and training in this particular field of learning. These are often really regulated or standardized learning based on evidence-based practice, current standards and guidelines. So they are very formal in that they have to follow national quality frameworks for education, especially for adult education. There'll be very specific structures to how these things are set out. You've got your learning outcomes, you've got your methods of learning, then you've got your methods of assessment and methods of assessing competency and then signing off on that. So there's very strict rules and guidelines to follow when you're making a course, when you're delivering a course, and sort of providing that course to the healthcare professionals. Then there's also those very measured learning outcomes, as I said, and those competency assessments are benchmarked against a framework there. In comparison to informal, now informal could be just something like watching some videos on YouTube, watching some instructional videos that might come with some equipment, being taught by a rep, a sales rep, or other medical representative, being taught by your peers, or something like that. So They are a bit more flexible and spontaneous. There's usually no official record of training that comes with it. So sometimes if you've done some on like online learning modules as part of your self-directed learning, perfectly fine to do so. And you will get a little certificate to say that you've completed that module. Is it technically training? Then we're going to apply that question to some considerations in a minute. So, and as I said, yes, they are often either peer supported with other colleagues or other allied health professionals or something like that, or they're self-directed. So there can be a bit of an inconsistency in the quality and the accuracy of the information. Now, obviously, if you're going to do a little online learning module, that's probably going to be a little bit more consistent with the quality and accurate with information. However, if you're just being taught by somebody else in the practice, then there can sometimes be that issue of, are they teaching you everything that you need to know? Are they teaching you just some of their bad habits or some of their incorrect techniques or incorrect information? Are they thoroughly going through the information with you so that you can then critically assess and analyze, applying that skill into practice? And so this is the issue that I have, I guess, in some cases where you are being taught on the job learning. And I'm not saying that this is not a critical aspect of learning, it absolutely is needed. But I think what we are missing is that ability to then discern how that person is competent after they've been taught by that person. And so that's often what's missing. I've often said to people that it's all well and good for you to be learning in the workplace, but that person who's providing that learning must set out some learning objectives, must set out, some key points that need to be uh, discussed, and the information given, and all that kind of stuff. Then there needs to be a method of assessment. And then there needs to be some documented competency in order to say, yes, I'm happy to say that nurse XYZ has been shown how to do this particular task and is competent in doing so unsupervised on a patient. Without having that little bit of a formalized framework within your organization, then I think it kind of lends itself to possibly some inconsistencies in how each person is going to then be deemed competent, but then you're leaving yourself open to having some safety concerns down the track. Anyway, I've kind of gone off a little bit there. And so, yes, there's that little to no competency assessment. Um, so, um, let's look at some considerations here, because we want to know which is the best way to learn. Is it going to be that formal or the informal? And so that is the question, the $1,000,000 question. And there's pros and cons for both. So let's look at those legal and ethical things. So the legal things is like what we must do. So we must conform to these things. Okay, so they're your legal things. Then of course our ethical things. What's the right thing to do? So we need to balance all of those kinds of things out. These all kind of like flow into each other a little bit as well. So insurance, so your professional indemnity insurance, to be specific here, and liability stuff. So if you aren't specifically trained in something and you are going ahead and doing it, are you then breaching any of your insurance legalities? Does that mean that that's going to nullify your insurance? And so therefore, if there is a negligent act, or if there is just um, an act of, you're being human and you've made a mistake, then are you going to be supported in that if you haven't been trained appropriately? We also then have the duty of care, um, which is to do no harm. And we, as nurses, we we basically sign ourselves up for this as part of our registration every year. So that we are going to declare that we're doing our continuing professional development, that we are going to declare that we've got all of our insurance stuff covered, that we are going to declare that we are following our standards of practice and our code of conduct and all of those things. Tick, tick, tick. Yes, we're going to do all of that so that then we can maintain our registration. So we're signing on for this and we're saying that we're agreeing to all of this. So we really need to be doing it. So the code of conduct stuff also very specifically tells us, I think it's standard number 6, or something about that. I can't remember, but to provide that safe, appropriate nursing practice, and it's evidence-based stuff. So again, we are directly agreeing that we are going to adhere to these things as part of our registration. The big one, patient safety. We need to provide safe care. So we need to do the tasks that we've been trained or qualified to perform. Therefore, we're going to reduce the risk of incidents and accidents or negligence, professional misconduct. All of these things, plus also causing harm, we're causing an adverse outcome to a procedure or a task that we've undertaken without appropriate training. So we've then exposed that person to some kind of harm. And I don't know about your conscience, mine wouldn't be okay with that. So these are things that you really need to think about when you're trying to determine, can I get away with not going and doing a course? Or will I just be okay to wing it if my fellow nurse tells me how to do it? I'm sure I'll be right. These are the things to consider. And as a nurse, you have to critically analyze all of these things in determining how you practice as a nurse. Something to bear in mind is that our code of practice and competency standards are actually admissible as evidence before a court as proof of the standards of health and safety that should be achieved by a duty holder, i.e. us, our duty. We are upholding our duty of care. So this is the standard by which you are going to be held accountable to. So there's that reasonable expectation in law that is it reasonable to expect that this particular registered nurse has done some training before they've performed ear syringing? The answer is yes, because there's a vast majority of nurses out there that have done the training, and there's an expectation there that you go and do these things before you perform any kind of procedure. So that's what they're going to hold you to. So that also brings in that, again, that critical thinking about, am I doing the right thing here? There are also some employer responsibilities, and I think these are also pretty well set out in things like the national state safety standards and quality guidelines, that they have a responsibility to ensure their staff are appropriately trained and that there are clear scope of clinical practice documentations available to them, that their job roles are clearly defined, and also to support practice, the practice to legally and ethically be doing procedures, and also to value patient safety higher than the income generation of pushing nurses to do tasks that they're not necessarily appropriately trained to do. So that's the responsibility there. And some employers are really good because they will provide the support to their staff. They will help to cover some costs. They will add into their throughout the year that they get X amount of days per year of education and training days, what have you. Um, so a lot of good employers will help to look after their staff in that respect. But unfortunately, there's also quite a lot that it does fall back on the individual to be responsible for their own continuing professional development costs and the time off that it takes to go and do those kinds of things. So when we go to the answer to the question of which is the most important thing to do, the formal or the informal training, I think it comes down to it's an aggregation of both the formal and the informal elements. We need all of it. So the formal training sets up the stage, but the informal kind of makes it real. So you need that learning transfer. You need that to go and apply the knowledge and the skills that you've just learnt into real world settings. And you do need your colleagues, you do need your mentors, you do need peer support to do that effectively. There is no, like no formal or informal training alone is sufficient in providing high quality care and ongoing development of skills. So no one is never going to be enough. You need to be able to do both. However, it's trying to discern what you need to have that formal training in to then follow on with the informal stuff in clinical practice. I think, well, I'm a firm believer that it's always better to go and get formal training wherever you possibly can, whenever you can manage it, because then you've got the safety of the very structured training that comes with that, that you have been assessed appropriately, deemed deemed competent, to then hopefully give you that confidence to go and take that into a workplace. And I use the the example of the ear syringing thing a lot because it's such a common situation. I know when I've gone off and learnt how to do it many years ago, I was thoroughly daunted after going and doing the 2 days of training, which was very, very good training. But then to go and have to put it into practice and looking into real ears and not pretend rubber ears and having to use the instruments to do the earwax removal on a real ear, that they all look so different than what they did on the mannequins that you train on. So it is daunting. And then to go and have to do some clinical, to do your practical kind of stuff, um, the more you do it, the more you learn, or the more someone can show you some tricks and tips and things like that, the more you will build on that knowledge that you gained from the formal training at the beginning. So I hope that sort of makes sense, that we do need a little bit of a combination of both to really solidify our skills and help us to give that high level of care. We do need to apply that rule of law to our critical thinking. Will what we've learned be considered reasonable expectation if it's challenged? So if in the unfortunate event that you happen to cause a mishap performing a procedure, a patient is unhappy, which is fair, they are calling into question your training, your competency to have performed the task, perhaps they're threatening legal proceedings or what have you. So this is when things will start to get called into question and be challenged. And if you do need to get legal advice, or if you do need to seek advice from APRA or a union, then they are also going to challenge you on this. What training did you have in order to perform these techniques or this particular task? So again, how are you going to justify how you learnt something And will it pass the pub test? Will it pass the legal challenge of what is reasonably expected of you? Is it in line with your duty of care, and is it also in line with all your professional codes and regulations that we are bound to as healthcare professionals? So, as I've already said, when we're looking at providing safe and appropriate care, evidence-based practice, all of those things are very clearly documented for us to do. So are we doing those if we're only relying on informal training? Continuing professional development is absolutely essential to maintain contemporary quality healthcare. So whilst it can be annoying, you've got to do it. It's really important to do it. It's in your best interest to do it. It's in our patient care best interest to do as well. And I think I read not long ago that there has been, with some recent things in the media about negligent cases or health professionals doing the wrong things. Some of the challenge that has been put to the courts is, what would you expect if this was your family member? So these reasonable expectations do get brought into those legal proceedings. So having a leg to stand on, a legal leg to stand on, will only set you in good stead and help to protect you, protect your patients, and protect the organisation or facility that you're working with as well. Not unheard of that, when something goes wrong, that you're left alone. So the only person that you can rely on is yourself. So protect yourself, and the organisation can worry about itself. You are okay to say, no, I'm not trained to do this. I'm not comfortable to do this. And don't do it, and document it if you have to. Put it in writing with that particular patient. Make a note if you have a HR person, manager, somewhere, somehow, escalate it to say, I'm not happy with this and this is the reason why. All right. I think that's it. So once again, thank you so much for joining me for another video. I hope that that's been a little bit. Please feel free to post questions if you have them. Check me out on my YouTube. There's other videos for you to check out if you're interested. Please consider subscribing or sharing them amongst your colleagues as well. I am often lurking around in a couple of Facebook groups, the Australian Practice Nurses page and things like that. So if you see me, say hi. And thank you so much once again. And it's always a pleasure to try and share some nursing knowledge and education with you. Bye for now.